Well, welcome back everyone to Soda City Live. In today's Be Well Wednesday, we are focusing on the leading causes of vision loss and how to treat those. Dr. Bethany Bray is an ophthalmologist with Lexington Medical Eye Care Associates, a new physician practice at Lexington Medical Center in West Columbia. Dr. Bray, I also want to brag on you because you are a local South Carolina girl, grew up in this area.
I did. I grew up in West Columbia.
Well, we're so glad to have you today.
Thank you.
Let's
happy
get
to
right
be here.
into some of those main eye issues. Let's start with cataracts. Exactly what are they and what causes a cataract?
Well, if you live long enough, Mother Nature's going to find you and show up with a birthday present called a cataract. A cataract is an age-related change in the lens fibers of your eye. Everyone's born with a lens in their eye. The lens works just like the lens of a camera, and it never stops growing. It's a little bit like hair. It never stops growing. And over time, the cells change, their structure and chemical structure changes with aging, and the lens turns cloudy, and that's what patients will notice as a cataract. Their vision becomes cloudy from
And
the lens
sometimes when you're
changes.
looking at someone, you can see the cloud,
You
so
can
to
see
speak,
the
over the
cloudiness.
eye. At what point does a person need to have that operated on? Because eventually, doesn't it just kind of blur the vision?
Typically, people will come see us before it's too big because it's affecting their vision somewhere in their lifestyle. They're not
Right.
driving at nighttime because of the glare and the halos around lights at nighttime. They're having trouble reading. They're having trouble discriminating hues of color. And something about their lifestyle is changing because they just can't see it like they used to. And then we do an eye exam to make sure there's nothing else going on affecting their vision.
Right.
And then when the cataract is big enough and thick enough that it's affecting vision and can be removed safely with modern surgical techniques, we talk about cataract surgery.
And what is it you do? Do you actually cut tissue up and off?
Well, it's a very fine incision. There are two very small incisions. One is 2.4 millimeters in size. The other one's less than 1 millimeter. An eraser of a pencil is about 6 millimeters. So
Right.
it's about a third of the
Right.
diameter of an eraser. And we go inside the eye and we bust up the cataract with ultrasound energy, the same type of ultrasound energy like when women are pregnant, you can see the
Right.
baby. Same type of ultrasound energy. And we bust up the cataract and remove it that way. And then we insert an intraocular lens implant inside the eye, which has a prescription in it. It acts much like a contact lens, but permanent inside the eye to correct your vision at the time of cataract surgery.
What about neuropathy, diabetic neuropathy? We hear a lot about that. What does a patient need to be watching for to see if he or she might be getting that?
Right. When diabetes affects your eyes, it affects the blood vessels inside the eyes, and the blood vessels can leak fluid from the blood or blood itself into the layers of the retina or frankly inside the eyeball, and it
Right.
causes blurry vision or changes in the way people can perceive shapes around them. Square lines may seem wiggly to them. And then we will look and see if the diabetic changes in the blood vessels are amenable to treatment, and we treat it.
Amazing. Let's touch on glaucoma while I still have you, because we always want to, be watching for that. What does a patient need to know specifically about glaucoma?
Probably the first place we see glaucoma, or a patient will notice glaucoma, is if it's in their family history. Otherwise, we pick glaucoma up from a routine eye exam. Glaucoma is a silent blindness. It's silent inside the eye because it doesn't hurt.
Right.
And it takes away your peripheral vision first. So that can be changing, and a patient may not ever know it. So doing a routine eye exam or knowing that's in your family history, we can pick it up that way and get it treated.
Dr. Bray, what about, you mentioned the regular eye exam. At what point should someone go on a regular basis? Like if you're a person who never wears eyeglasses, has never had contacts, has great 20/20 vision. As we get older though, notice I'm carrying my little readers. At what point should we all go for a yearly exam?
For those who've never worn glasses before, that's classically, that little problem right there is classically when we first see patients. But before that, sometime in your late teens and early 20s, everyone should have an eye exam just to look for screening for eye diseases and eye disorders where glasses might be needed, or other medical diseases of the eye which could be threatening to the vision and would need treatment.
Okay, excellent information. Dr. Bethany Bray of Lexington Medical Eye Care Associates, a new practice. They've not had ophthalmologists there on staff. They do now, so thank you so much at Lexington Medical Center.
Thank you.
Thanks, Dr. Bray.
Thank you.
Be Well Wednesday continues now with Billie Jean in Studio A.